Hello and welcome to Cancer Reach. Cancer Reach is an initiative to spread awareness about cancer. October is Breast Cancer Awareness Month. Breast examination is of two types: self breast examination or clinical breast examination. Self breast examination is the woman herself examines her breast for the presence of any lump or swelling. Clinical breast examination is you go to a doctor and the doctor will examine your breast for the presence of any lump in the breast. In Western countries or in developed countries, it has been proven that self breast examination or clinical breast examination is not an effective screening method. What it means is, in those countries, by doing breast examination themselves or by doing it in a clinic as a part of a regular process, maybe once in 6 months or once in a year, it is not effective in detecting lumps early, or many times a lump could be detected and a biopsy is performed and it is not cancerous. So what happens is the anxiety or the tension in the patient increases, and many times the patients are unnecessarily biopsied for a lump which is not cancerous. But we cannot apply the same rule in a developing country like ours. In our country, still a lot of women present very late. Though they have a lump, they don't even tell their family members. They don't seek medical opinion very early. Because of which what happens is the small swelling grows in size, it spreads to the lymph nodes, or it becomes advanced. So in developing countries like ours, we would encourage self-breast examination. It is better that you have a look at your breast. See if there is any lump. See if there is any change in the skin over the breast. If there is any bleeding from the nipple. If there is any indrawing of the nipple. If there is any destruction of the nipple. Or if there is any lump in your armpit. If you find any such thing, or if the lump is growing in size, go and show yourself to a doctor. It doesn't mean that you should get tensed immediately if you have a lump in the breast or a small swelling and that it is cancerous. No. It could be, swelling in the breast could be because of many non-cancerous conditions. But in our country, when patients are presenting very late to the doctor, when we see breast cancers in much younger women, and in our country, considering our population and the number of doctors per patient, which is less compared to the developed countries, it's always better that we are on guard. Examine the breast. If you find a lump, go and show to a doctor. Your doctor will evaluate whether it is cancerous or non-cancerous. In this way, if it is non-cancerous, there is nothing to worry. If it is cancerous, you're detecting it in early stage. Remember, all the lumps are not cancerous. In younger women or women with dense breast, it is difficult to find a lump. Also, sometimes what we have seen is during pregnancy, women also can develop breast cancer. During lactation or breastfeeding children, they can develop swelling or lump in the breast, and that is confused as a normal thing. So pregnant women or women of childbearing age or breastfeeding mothers, if you have a lot of heaviness in the breast, if you have a lump in the breast, do not ignore it. This is not to scare you, but we should be aware, because there are no rules for cancer as such. Though we say that breast cancer occurs in more commonly in women above the age of 50 years, all of us have seen breast cancer in very young people, also in pregnant women, also in women who breastfeed their children. So what we should understand is, do self breast examination. If you find a lump which is growing in size, or a new lump which was not there earlier, show a doctor. It could be a benign lump or a non-cancerous lump, but show a doctor. And if you have a lump when you're breastfeeding your child or when you're pregnant, it could still be benign, but again seek medical attention and do not ignore it. Be breast aware, be breast cancer aware.